Dr. Rosalyn Morrell is recognized by her patients and peers as one of the best board-certified radiation oncologists in the Los Angeles area. For nearly 20 years, Dr. Morrell has been committed to giving the highest quality care through compassion, communication, and connection. She's also the founder of Centerpoint Radiation Oncology, a private, modern, state-of-the-art cancer care clinic in Beverly Hills, California. Dr. Morrell is also the founder of Centerpoint Radiation Oncology, a private, modern, state-of-the-art cancer care clinic in Beverly Hills, California. At Centerpoint Radiation Oncology, they treat all sites and stages of cancer and utilize the leading-edge variant TrueBeam technology to provide the most advanced cancer treatment available. They treat all types of cancer, including breast, prostate, lung, head, and neck. Welcome to the EO Wonder podcast, Dr. Morrell.
Thank you. Thank you so much for having me.
So I'd love for you to take us back to when you wanted to become a physician. I understand that there was a story from when you were 11 years old.
Yes, I was riding my bike with my stepsister, and we were riding around an empty parking lot, and she fell off of her bike and she bruised her elbow. And it was pretty bloody at that time. And we ran upstairs. I helped her wash the blood off and clean up her wound. And I was fascinated. I was just like, wow, this is kind of cool. I enjoyed the helping her, clean up the wound and just making her feel better. And after that, I kind of got interested in the human body and how the human body worked. And I would say that was the first time I kind of thought about medicine.
So how did you choose cancer as a path for your medical practice?
When I first entered medical school, I was so excited to become a surgeon. And I thought surgery was the path for me, and very, very, happy and excited to go that route. And the first 2 years of medical school, so the first 2 years of the 4-year program, you're doing mostly book study. And then the last 2 years is when you actually get to rotate through the different fields. So my 3rd year of medical school, I got a chance to rotate through surgery. And I came across the surgeons. And back in the day at that time, and I believe medical school has changed a lot, but back in the day, it was very much about kind of being very harsh with the medical students. And one of the things that really kind of stood out to me in terms of a lot of the rotations was the treatment of the medical students. And actually, part of the program was humiliating the medical students, making them feel like they didn't know anything. Pretty much a culture of, we're going to drill this into your head, and we're going to do it in a way where it may embarrass you, but we don't really care. This is what you signed up for, and this is how we teach. And I would say that when I came across the surgeons, they were very much in line with that. And it's not to say that they were horrible human beings, because they weren't, but that was the culture of medical school. And I just did not like it at all. And again, it wasn't just the surgeons. It was a lot of the physicians in the different specialties. But I think because I wanted to become a surgeon, and when I got to that rotation, I was a little disappointed. And I didn't feel like that was the area for me. And as I continued to go through my medical rotations, I did a pediatric rotation, and I love kids. And I thought, okay, well, that maybe this is for me. And I came across a little girl. She was about 4 years old, and she had to get radiation therapy for a tumor that was located on her kidney. And as a medical student, you are supposed to follow your patients around from the time they get admitted to the hospital to the time that they're discharged. So that means if they're going into another department in the hospital, you are there. You are watching everything. You're taking your notes. You're participating in their care. And she went down to the radiation oncology department, which I had never heard of. So we had not previously had any lectures from any of the radiation oncologists, in the prior 2 years. So this was all new to me. And I'm like, wow, what is this? What's this department? And of course, it was down in the basement. And she met the radiation oncologist, and I met the radiation oncologist as well. And she wound up getting radiation therapy. And it was a very involved process because she was only 4 years old. So we had to have anesthesia come down. And so she had to get general anesthesia so that she could, lay on the table nice and still. And I just fell in love with it. I thought the doctors were so helpful. Here they were treating this little child with so much compassion and, so much understanding and helping the parents deal with the whole process. And I just really connected with those physicians. There were residents in the department. I connected with them and I just fell in love with it. And from that point on, I kind of knew at that point I wanted to be an oncologist. I want to help patients who have been diagnosed with cancer.
And that's how your culture in Centerpoint Radiation Oncology is as well, too. You treat everyone, your patients, also like family. Tell us a little bit about that.
Yeah, cancer is a very scary, very difficult thing to go through. When you're diagnosed with cancer, and because of, how we feel about it and how the media and how just our society looks at cancer, they're facing their mortality for the very first time. They're really thinking about it because they know that a lot of people don't survive cancer. And when you are in front of someone who is experiencing those emotions and thinking those thoughts, you really have to take your time and express to them that you are here for them. You're going to help them get through this. I'm going to share my knowledge with you so that you have a better understanding of what you've been diagnosed with. So your fear, hopefully, and what I try to do is that when they walk into my office and they are very fearful, and you can see it and you can hear it, what I try to do is give them as much information as possible in a very compassionate way so that when they do walk out of my door, they feel better. It's not a mystery. It's not a, oh my God, what's going to happen to me next? It's a feeling of, okay, I have a little bit better understanding of what I'm dealing with. I understand what you are planning to do for me. I have a better understanding of what the other doctors are planning to do for me. So now I am better equipped to face this.
The reason why I wanted you on the podcast, besides you being so brilliant, is one of my entrepreneur friends recently passed with lung cancer. So he's been part of the Entrepreneurs Organization in Los Angeles for 14 years. I've known him for 14 years. His daughter and my, several of my other friends, have gone through breast cancer. And you also focus on both breast and lung cancer, right, in your practice. Is there something that entrepreneurs do? Entrepreneurs get cancer more than anyone else because they're more stressed out? Or can you tell us how we could prevent cancer, or maybe have a discussion around just cancer itself?
Yeah, absolutely. There's no data supporting that entrepreneurs get cancer more than other individuals, but stress is a contributing factor. We know that there are other factors that are also involved in people getting diagnosed with cancer, and that includes family history, that can include some genetic abnormalities, that can include things like smoking, being exposed to harsh chemicals, carcinogenic chemicals. Diet can play a role as well, and there are other factors. And we talk a lot about diagnosis, we talk a lot about treatment, we talk about chemotherapy, radiation, immunotherapy, but another important aspect is actually cancer prevention. What can we do to hopefully not get cancer? One of the things is essentially not smoking. We know that there is a direct correlation between tobacco and potentially getting lung cancer. And so a big preventative step is, if you're smoking, please try to stop. Or if you have not started smoking, don't start. Don't do it at all. And that really has shown to be a big, big difference in terms of lung cancer. Other preventative measures, really a lot of it also has to do with cancer screening, and that can be quite scary. There are a lot of different ways to screen for cancer, and we do different things for the different cancer sites. So lung cancer screening is going to be different than breast cancer screening, which is going to be different than colorectal screening. And some of these screening tests are invasive and they require blood work and, going under anesthesia and things like that. But they're so necessary, and we are able to pick up early stage cancers when people are going in for their screening. And if you are going in for your screening at the appropriate times, sometimes precancerous lesions can be found that can be removed at that time, and therefore they will not turn into cancer. So that's a huge preventative step, and something that I try to talk about with my patients as well, because even if you've been diagnosed with cancer, let's say, for instance, you are someone you've been diagnosed with breast cancer, you can't forget that you still need to be screened for something like colorectal cancer or some of the other cancers. So that's something that we definitely need to talk about and make sure that people have a good understanding in terms of what the appropriate age and time frame is to get their screenings. Other preventative measures include diet, exercise is important. We know that. And like we mentioned just a few minutes ago, a reduction in stress. And stress can impact our bodies in significant ways. And we do also need to try to decrease our stress, which can be difficult and very difficult for entrepreneurs. But it's always a good idea to try to do what you can, even if it's a small step, to decrease your stress level. Do something that may not require a lot of time. Maybe it's, instead of working 5 days a week or sometimes 7 days a week for entrepreneurs, we cut back. Maybe we work 6.5 days, or maybe we work 6 days, or taking that time to leave work early. Go get a massage, go do something that you enjoy, get your mind off of work and everything that's happening. So it doesn't have to be where it's something that's going to require, you being away from work and your responsibilities and maybe your children and other things like that for a significant amount of time. It can be something very small.
The majority of our entrepreneurs in EO are male. And I know that one of the main focus that you have is also prostate cancer. Is there anything that specifically male entrepreneurs can do to prevent prostate cancer besides diet? I mean, or is it the same? Diet, screening?
It is. It really is. I treat a lot of prostate cancer. I treat all types of cancer in my clinic, but the most common that I treat in terms of disease sites would be prostate cancer. And the preventative measures for prostate cancer do have to do with diet and checking your PSA, so screening with PSA and knowing when to screen for PSA, and making sure that if you have a family history of prostate cancer, or if you're African American, your screening for prostate cancer may have to start a little bit earlier. And knowing your family history, I think that is something that we don't necessarily talk about too much with people. A lot of times I'm in front of individuals and I ask them, what's your family history? Anybody else in your family with prostate cancer? Your dad, uncle, other brothers? And you'd be surprised by how many people don't know their family history. And again, that has to do with our society. It's not easy to talk about the big C, and not always something that we want to divulge to our family members, but it does play a role. And we know that family history is quite important. So if you have individuals in your family who you think may have cancer, it's always good to talk to them about it, so that if you do ever get diagnosed with something like prostate cancer, you can then communicate that to your physician. Because we have tests now, we have genetic tests that we're doing, and we're running genetic tests for a lot of the different cancers. So with prostate cancer, it's important to be screened for it and know what the PSA is. And PSA stands for prostatic specific antigen. And it's a simple blood test that your primary care physician can do. You don't have to go to a special lab. You don't have to go to a special doctor. Your primary care physician can screen you for prostate cancer. And it also includes usually a digital rectal examination that your primary care doctor can do right in their office. And it's very simple. And so I would say for all men, and again, those that are busy and stressed and things like that, understanding your family history, decreasing your stress, getting your proper screening done can all help prevent prostate cancer.
At what age would someone who doesn't have a genetic history of prostate cancer start checking?
Usually, in some of the different organizations have different recommendations, but it's generally at age 50. You should start getting your PSA checked. And again, if you have a family history or if you're African American, we advocate that you start a little bit earlier, but usually at age 50. And if you don't know, if you have turned 50 or older and you don't know if your primary care physician has been checking your PSA, you can always ask and ask for it to be done and also get your result. And there's been a little bit of controversy actually around PSA. We have been using PSA for several years, many years, and it has been practice changing. It has been life changing for a lot of men. We have caught prostate cancer, and generally we say that prostate cancer is slow growing, but that's not always true. And men are still dying from prostate cancer. As a matter of fact, it's estimated that there are going to be about 230,000 new prostate cancer cases, with approximately about 34,500 deaths. However, with the controversy around PSA several years ago, the United States Preventive Task Force came out with a recommendation that primary care physicians should stop checking the PSA in certain individuals, or it was more of a blanket statement. And primary care physicians took that advice and actually stopped checking the PSA because the argument was, we are over treating these gentlemen. We know that generally prostate cancer is slow growing. A lot of times, if you leave it alone and you don't treat it, a lot of times you will pass away or die from something else. But again, that's not always true. We know that prostate cancer, there's different stages of it that men can present with, and it can be aggressive in different ways. So still screening for it has always been important. And we historically made great strides in reducing the death rate from prostate cancer. However, when this recommendation came out many years ago, again, a lot of the family practitioners and primary care physicians stopped drawing the PSA. And what I actually saw a direct impact in my clinic, and I've talked to and I work with several urologists, and they have said the same thing. We all started seeing men then presenting to us with more advanced stages of prostate cancer. They were getting basically their diagnosis after developing significant symptoms, because a lot of times you will find that men who have prostate cancer, a lot of them don't have symptoms. But when they stopped checking the PSA, then those individuals started to basically present with more symptoms, and that essentially meant more advanced disease. Now that recommendation has changed, and we are now going back to where primary care physicians are having a discussion with their patients. And I'm seeing more and more that, the PSA is being checked. And now again, I'm seeing, an earlier stage of prostate cancer coming through my door. So again, it's a very important test. And now in 2022, I would say again, we're back to where we're relying on the PSA. It is helping us. We know that it's a crucial test. And the beauty of the test, again, is that it's a simple blood test that your primary care physician can do very easily. But you have to know your numbers. Your numbers are quite important. And if you don't know what your number should be, you can always ask your doctor and they can tell you. And if there's anything abnormal, most of the time, men will be referred to a urologist for further evaluation.
And we do have a lot of women entrepreneurs also listening. So this is really great advice, whether or not they're giving advice to their uncles or their husbands or their significant others to get screened, because a lot of times too, I know that for my husband is just like, if it's not hurting, like, why do you even have to go?
Right.
Why are men like that? No, I'm just kidding. Why are people like that?
I think, yeah, you're right. It's like, it's people. I think we're all like that. We feel like a lot of times what we don't know won't hurt us.
Or they're scared.
They're
Right?
scared. Right. They're very scared because you don't know. Well, if you go and you get screened or anything like that, what if they find something? And then what? And it could be advanced. We all have that feeling of, oh gosh, I have this headache and this headache is not going away. Oh my God, do I have a brain tumor? It's stuff like that. And it's fear. But again, catching things early really is so much better. As an oncologist, I can tell you with my experience with pretty much all of the cancers that I treat, the earlier it's caught, the better. It's easier to treat. It's easier to treat with surgery. It's easier to treat with chemotherapy. It's easier to treat with radiation therapy. And sometimes all of those treatments aren't even needed. Sometimes it's just surgery. You just surgically remove it and you're done and you're fine. So it does have a lot to do with fear and changing our behavior and working through that. I don't know if we have found the magic answer to that. I think, we're constantly working on it. But I think that's how a lot of people are.
So let's talk a little bit about preventing cancer. And also, by the way, everyone who's listening, Dr. Morell is also the host of the Cancer from A to Z podcast. Definitely, I'll put in the show notes so that you can also learn more about her podcast. If you are concerned about cancer or just really want to be more knowledgeable about it, it is really an effective way to learn more about cancer. But let's talk a little bit about prevention of cancer. You talked about diet, and I know that you recently got a certification on nutrition from Stanford University. Is there something that you can share specifically of how people can change their diet? Because again, people always say you got to eat well, you have to exercise. Very simple advice, but it's not easy.
It's not easy. And when you do get that advice, is it actionable? Do you know exactly what that means? And I think that's part of the problem when we tell people you need to eat healthy. Well, what does that mean? I don't know. Eating a piece of cheese, is that healthy? I don't know. Having red meat, is that healthy? So I really enjoyed my nutrition class and I learned so much. And the reason why I took the nutrition class was because back when I went through medical school, and again, things have changed, but back when I went through medical school, nutrition was not part of our curriculum. Not at all. I do not recall really any lectures on it. There might have been one very small one, but it was just not part of our curriculum. So there are so many physicians out here who, if they are knowledgeable about nutrition, a lot of it has to do with their own personal experience, or maybe they took a course, they learned about it, in terms of their work or their research, and that's how they learned about it, and they communicate that to their patients. But I will say probably there's a good majority of us who we're not well versed when it comes to discussing nutrition. However, what we eat really does matter, and it does impact our health and the development of cancer. We know that there are certain foods out there that in the processing of that food, that certain chemicals are formed, and those chemicals can have a direct impact on us in terms of our stomach, which can then lead to stomach cancer. We know that there are diet-related things when it comes to other types of cancer, like colorectal cancer. And so what we eat really does factor in. And a lot of people think about sugar and the bad things associated with sugar. And sugar can cause inflammation. Sugar can cause significant changes, especially if you have a wicked sweet tooth. You're eating lots of ice cream and drinking lots of soda. We know that sugar does play a role. But what I learned in the nutrition class, it's unbelievable how much bad things or how many bad things are in our food that we don't realize. And for instance, with cheese, lots of saturated fat with cheese, and learning about the differences between monounsaturated fats and polyunsaturated fats and trans fats, and learning how to read a label and what to look for on the label, and understanding what those added sugars, when you see that on the ingredients, on the food label, looking at that and knowing and understanding what added sugars means in terms of what you're getting ready to ingest. So how I talk to my patients right now in terms of what to do, because I do get asked this all the time. What should I be eating? What should I be eating as I go through radiation? Or what should I be eating right now just because I've been diagnosed with cancer? And when we say healthy diet, we do mean you want to eat things that are low in sugar, low in those, fats, those saturated fats. You want to eat lots of vegetables and plenty of fruit, and be getting plenty of water. And there's lots of resources online, but there's one called Healthy Plate. And Healthy Plate is a fabulous resource because it specifically spells out what should be on your plate. So you should be having a certain amount of this food, a certain amount of this, a certain amount of this, and a certain amount of that. And it's a good guideline for individuals to follow. And it includes making sure that you're getting the vegetables. And when I say vegetables, I mean all the colors, the red, the yellows, the oranges, all of the colors, the greens, making sure that you're getting the proper amount of grains, the proper amount of protein. And protein is a big one, because a lot of people think, well, I can only get protein from meat. I can only get protein from red meat, or I can only get protein from chicken. And that's not true. If you eat a well-rounded diet, so sometimes, people look at vegetarians and vegans and they're like, how are they getting their proper nutrition? But if you are eating a well-balanced variety of foods, and it can all be plant-based, you can actually get all of your protein needs met. You don't need chicken. You don't need red meat. You don't need anything else. It can all be plant-based. But the key is actually making sure that it's a well-rounded diet where you're getting a variety of those plants. So I see when I talk about that now with my patients, they're quite surprised, because people, again, think, oh, I need to have a steak once a week or twice a week to get my protein needs met. And you actually don't. And that's been huge. And I've really enjoyed having those conversations with my patients. I was having those conversations with them before the nutrition class, but I was able to actually go a little bit deeper in the nutrition class and get to the level, certainly not the level of a registered dietitian or who has gone through years of training for this, but with a understanding now of being better able to communicate what are the things, what are the actionable steps, instead of just saying, oh, a healthy diet is what you need.
And I also think it's training. I remember when I was, with my daughter, volunteering at this, with this inner city school, and the teacher was throwing away all the salads. Rather than giving it to the kids that were there, she was just like, well, this doesn't taste good. And literally in front of all the other parents, so, I mean, we're in California, so I guess there's like West Side and like the inner city, which is really hard to see that discrepancy. But literally, she took the salads and the fruit, and she tossed them in the trash.
Mm-hmm.
And she wanted to give them the yogurts, the dairy, and all the other things that weren't really good for you, the chips. She kept it. So it's also probably, I mean, we live in an environment where we are succumbed by all this bad food. Both of our daughters go to Harvard Westlake, and I was at the volleyball tournament yesterday. And again, we were at this, Kennedy High School, in the middle of California, and they had barbecue set up. They were selling charred meat, which we know is carcinogenic, right?
Right.
Like charred meat to these young volleyball players, hot dogs, hamburgers. And I was just thinking to myself, like, wow, like it's part of the environment. So how do you get out of, like, if you're in an environment where this is like, how do you even get out of that mindset of trying to eat well when you're surrounded by it?
Yeah, that can be very tricky. That can be extremely difficult, especially if you are a teenager like our teenagers, or even if you're a young adult and maybe you're still living at home and you've been educated and you know that, okay, this food is not good for me, but yet your parents are cooking it and serving it to you. So individuals run across that all the time, even older individuals who are married or in a relationship, and they're trying to change their diet, but maybe their significant other is kind of, they're eating these foods that they know are not good. So it can be quite tricky. And one of the things that you can do essentially is actually start making the food yourself. If you have that ability, or if you have the ability to maybe go to the grocery store and pick out the things that you want. That can be one of the things. Sitting down with your parents or maybe significant other and going through some of this information in terms of how these things may not necessarily be good for you, and trying to, do it together and making small changes. But I will say that can be quite difficult. If you're trying to really change your diet, but yet important people around you don't want to, don't believe in it, or, for whatever reason. But it's doable. It's absolutely doable. And it can be, again, small changes that you make. It doesn't have to be something drastic or huge. It can be small changes. So if a lot of times we know that dairy is not necessarily great for us. So cutting back on the dairy, not drinking the glass of milk, not having, some of those things, or cutting back a little bit on, if, let's say, for instance, your family, they like to order fast food. And so you've got burgers and fries sitting in front of you. So maybe if that is tonight's dinner, maybe if that restaurant that you're getting that food from, if they offer something else, maybe like a salad or something like that, you can pick that. But I agree with you. It can be difficult, but it's definitely doable with small steps.
I know, because throughout even the United States, there are so many what they call food deserts, right? So here in California and Los Angeles and where we live, like, it's easy to eat well. What do you do when you don't even have that? And I guess start off with that. Is it an app, healthyplate.com? Is that an app, or is that a website that they
It's a
can go
website.
to?
It's a
Okay, it's a
website.
website.
Yeah. It's when you're right. A lot of us have the luxury of eating well, but so many of us don't. So many of us here in Los Angeles don't. And they live in areas where they don't have grocery stores close by, or they don't have certain grocery stores like Whole Foods. Whole Foods may not be in their neighborhood. And the stores that are in their neighborhoods, maybe they don't have the fresh fruit or the vegetables. So trying to change your diet and trying to eat healthy, it's in a sense almost out of your control because you don't have access to those things. And that is what's really difficult to, I think, comprehend and process and understand, that even in 2022, in a huge city such as Los Angeles, that we have individuals who are living in areas where they can't even get to fresh fruit and fresh vegetables when they want to. in order to live that healthy lifestyle. And there's so many factors that are part of that and cause that. And, a lot of it has to do with policy changes. Again, that's a whole nother conversation. It's a whole nother conversation. But, and there are things that we need to do to correct that situation. The disparities that exist especially it's relevant for me as an oncologist because we talk about cancer health disparities, but you can just say health disparities in general. And you just see it so much where if you go a few miles down the road, it's a completely different environment and people are dealing with different things. For instance, for me with radiation oncology, the way radiation works, you come in 5 days a week. And so you have to be able to take the time off of work. You have to be able to travel, and not everybody can do that. And so as physicians, we talk a lot about eating healthy, change your diet, do this, do that. But for certain individuals, that's not easy. That's difficult. We talk about, trying to get minorities onto clinical trials and things like that, and having access to good medical care, but they don't have access to good medical care all the time. They have to go to work. They have to provide for their family. They don't have the luxury of taking time off, or maybe the cancer facility is not close by. It's not a mile down the road. It's actually 7 or 8 miles away, and they have to take 2 buses, a train, a number of different things. They have to walk in order to get to their cancer treatment. So food deserts, the lack of good medical care or access to good medical care, the financial aspects of all of this, they all contribute to health disparities. So I definitely want to say that there are so many individuals who are trying. They want to do better. They want to eat better. They want to, live a healthy lifestyle. But unfortunately, they have some things working against them that are kind of out of their control.
And I think what I also see too is when they do get the cancer diagnosis, is that's the catalyst. Like, what if it wasn't the catalyst? What if you started preventing it years before by exercising 20 or 30 minutes a day, drinking more water? I love that tip of just drinking water. I didn't know that drinking water would help prevent cancer, but I guess it makes sense.
Water is the best thing for you. Our bodies are, made up of water. We need water. We need water to basically flush out our systems. And, soda's not good for us. Juices, orange juice, things like that, the cran apple juice that you can buy that we all love, it's bad for you. It's full of sugar, and that's not really doing anything for you. We go back and forth a little bit on things like coffee and, whether it's good for you or not good for you, but good old fashioned water. And a lot of people don't like plain water. And so you can, jazz it up a little bit and add a little bit of cut up fruit. But water is really important for us. And I have come across a lot of individuals who they don't like to drink it, or maybe they're drinking very little. And so, they like to add, well, I drank a can of soda, or I had, 2 cups of coffee. Doesn't that count towards my water requirement? And it actually doesn't. So I've seen the benefits of making sure that you stay well hydrated. We know that when we're not well hydrated, that can lead to a number of complications, but especially for cancer patients who are going through treatment, you need water. Absolutely.
Well, if they don't really like water, they can drink Hint. So what I just had Kara on the podcast recently. So Hint water has, that little flavor, but I don't know, would that be approved by you? That's a little bit of flavor.
Yeah, that would be fine. That would be fine. And I think things like that are fine. And it's so much better than, reaching for the Coke or the Sprite or the 7-Up and things like that. And sometimes people drink a lot of diet soda and think, well, it's diet soda, so that's okay. But that's not always okay either. And that can be detrimental in terms of some of the ingredients. So we're, as physicians, we try to make sure that we communicate that information to our patients, and especially and like you said, those that get diagnosed, sometimes that's the catalyst. That's the thing that finally pushes someone to say, enough, I'm not going to do this anymore. I'm going to change my lifestyle. And, unfortunately, if it has gotten to that point, well, that's okay. At least, it's something that you've recognized and you say, okay, from here on out, I'm going to change how I do things. And that can only help you.
Let's also talk a little bit about stress, because that is for sure common from you are a physician slash entrepreneur, and all the entrepreneurs that we have on the podcast. Oh, I mean, we have stress all the time. And one thing that I was really amazed by you was how you know your limits, and you can literally say no. Like, if someone's asking you to speak at this conference or be on this podcast or, so on and so forth, you are willing to say no because you know what your limits are. What type of advice, which I think helps with minimizing your stress, what type of advice would you give to the entrepreneurs listening about how to minimize their stress?
My advice would be recognize first and foremost, I think you have to say, okay, I'm stressed. I'm feeling it. I am definitely experiencing stress. This is causing me to, you know, not feel good, and just acknowledging it. Acknowledging that's key, because I think as entrepreneurs, we try to push that aside. We try to push through. We have things going on in our businesses, and we don't have the time to not be focused on that. And so you start to neglect yourself because you're so focused on your business and making sure that things are going the way that you want them to go. But you have to take a step back and say, wait a minute, I can feel changes in my body happening. I'm getting headaches. I'm not sleeping well. Those were the things that were happening to me. And I had to just say, this is not right. I can feel it. My body's telling me something, and I'm feeling very stressed. And I was okay. I've had to get to the point of saying, I'm okay saying that. I don't have to be superwoman all the time. And I have my limits. I just can't do it. And of that took a lot of time for me to get to that point. But once I did get to that point of saying, I just can't, I know that I can't do this right now. Now is not a good time for me maybe to give this talk or do this other activity that I'm being asked to do. And so when I actually acknowledged and said, it's okay for me to say this, it's okay for me to communicate to others around me that, again, I just can't, I have my limits. That's when things actually started to change for me. So I would say first and foremost, don't be ashamed to say that this is not working, or again, I'm stressed, I'm feeling overwhelmed. There's nothing wrong with saying that. As an entrepreneur, we have a lot of responsibilities on us, and we have employees that we need to take care of. You have your family that you need to take care of. But you also have to take care of yourself, because if you're not taking care of yourself, then how can you take care of others? And you do have to put yourself first. And saying no is part of that, and understanding, and creating boundaries. I think we all have problems with creating boundaries, and we sometimes that can get in the way when we don't create those boundaries with individuals, whether it's personally or in our business. And again, it goes back to, you don't have to say no to everything. It's small changes. It's small things that you can do to take back your time and to rest and to relax and, recover a little bit. You need rest. We need to be sleeping well. And if things are going on in your business and you're recognizing that you're not sleeping well, what is it that you can change? Can you delegate something? Can you give a task to somebody else potentially? That can be helpful. That's something that you can do. Can you get a virtual assistant to help you with something? Maybe this employee who maybe doesn't have enough to do right now, maybe they can take on an additional task. So there are things that you can do that don't necessarily mean that you're going to shut everything down or shut everything off or push everybody away. It doesn't have to be that way, but it's the small things. And if you don't have time to do a presentation or do a talk, or, that's going to take up a significant amount of your time, then just say, thank you for really, thank you for inviting me to do this talk, but right now is not a good time. Maybe circle back with me in about 3 to 4 months. And I've learned that. And it's actually helped me, because instead of me taking on that task and being upset and being angry and being basically spread too thin, now I've let this individual know, yes, I'd love to do this. I can't do this right now. Reach out to me in a few more months. And now that's freed me up. And now I'm actually looking forward to it. And I've got time to devote to the presentation if I'm going to give it in the next few months. It can be a very freeing thing, actually, to say no. So.
And I also love how you prioritize your time. You prioritize time to do your Cancer to A to Z podcast, because when you put your content up on a platform where it's available to the public, where you're educating tens of thousands of people, it seems really effective than talking to, a small group of people in person or, on virtual Zoom or right. So I think that you understand how to prioritize your time.
And again, I've learned that recently, taking on the podcast, that's a passion for me. I love it. I absolutely love it. As I have practiced medicine for the past 17 years, I just love educating people about cancer and health in general. And one of the things that I've noticed over the years with cancer is that, again, going back to that fear, and there's a lot of things on the internet and a lot of resources, people, family members who have been diagnosed, friends who have been diagnosed, that like to communicate their experiences to those who have just recently been diagnosed. And sometimes it's good and sometimes it's not good to listen to that. And we make fun of Google and we call it Dr. Google, because there's so much health information on the internet and not all of it is good. And I really started to notice that people needed to have better resources to find on cancer information and really get the proper information on these different types of cancers. So that's why I started the podcast. But with me taking on this practice and buying this practice, and now truly, being an entrepreneur, with my time and everything else, I had to learn time management and get better with my time. Because I'll say, before I started the podcast and when I was an employee, I probably wasted a lot of time. Netflix and things like that, that can really suck you in. But I've learned recently, after becoming, like I said, purchasing this practice, and that time management is key. And one of the things that has actually helped me quite a bit is time blocking. It's amazing. It's amazing. Never did it before. And now I'm doing it. And it is amazing. Taking my calendar or listing out the things that I need to do for that week, and then taking those things that I need to do, putting them on my calendar in set blocks of time, and trying to follow that calendar as closely as I can. It's amazing how much stuff you can get done. It's incredible. And it helps also to prevent multitasking. It really does, because that's something that I definitely am not good at. I have to be, in a sense, where I have to do it sometimes at work, but I'm not necessarily, I don't think any of us are very good at multitasking. But when you time block, and you've got that designated time, this particular, between 1 and 1:30, I'm going to do this. Between 2 and 2:15, I've got this task to do. You can get so much done.
It is so true. I love time blocking. I even have a little calendar. I have a little clock. I see my little clock where I will say, okay, for 15 minutes. And you realize how much, like you said, you can get done in 15 minutes. Like writing my newsletter, I'm just like, okay, you've got 15 minutes, go.
Yeah. And you've definitely helped me stay on track with that. You've helped me quite a bit, because there are times when I'm just like, oh, I got something else to do. I really don't. But it's like, nope, we're going to sit there. We're going to do this for the next 15 minutes and just knock it out. And you feel so much better. But I think the other thing that has helped is actually you put in your time in terms of work and the things that you need to get done. You realize all this free time, but then you put in your free time on your calendar. You put in your free time between 6 p.m. and 9 p.m. I'm hanging out with the kids. We're going to watch a movie. Put that on your calendar and follow it. It's amazing. It's been a game changer for me. And it's been great.
One thing I remember, I think we were talking a couple months ago that, you love to laugh, like you told me, and that you will literally like block out one day in the weekend and just like, I'm just going to watch funny movies.
Yeah, I'm a big kid. And whether that really kind of fits with being a physician or being an oncologist, I don't know. I've been nicknamed the funny oncologist by my friends because I love to joke. I love to laugh. And I think part of that has to do with the fact that I am in a very serious environment and I practice medicine. It's not like delivering babies, which, 99% of the time is usually a happier event. Cancer is not. When you are curing people or when their cancer is gone and has not returned, of course that's happy. That's great. But that doesn't always happen. So it is having time to relax and laugh has been absolutely needed for me. And I'll take a day off and I'm just sitting there watching funny movies. I love comedies. I absolutely love comedies. I don't want to see a murder show. I don't want to see, a drama necessarily. I want to laugh. And laughter is the best medicine.
Yeah, and I'm sure that's advice that you give to your patients as well, too. I know that I've heard people who have gotten their cancer diagnosis, they're going through radiation, chemo, or whatever treatment that they have, and they are watching funny movies and they're overcoming their cancer because they're changing, I guess, their essence and they're more relaxed.
Right. Absolutely. They are. And that really does help things too. When you're more relaxed and you're not stressed and you're not angry and you're not, tense, you can get through your treatment. Your body responds better to the treatment. Absolutely.
So with September and it's Prostate Cancer Awareness Month, and what type of advice would you give to someone to be more aware about prostate cancer?
I would say, again, know your family history if you can. And then not everybody can. Some individuals don't know their family history and will never know their family history. But that's one thing. And go in and see your doctor if you're noticing anything, or even if you're not noticing any symptoms at all. But for sure, if you've noticed that maybe you're urinating a little bit more frequently, maybe you're getting up more often in the middle of the night to urinate, maybe you can't hold your bladder quite as long, maybe you've had a little bit of burning or have noticed a little blood in your urine, don't be afraid. Go in to your primary care physician, have them check it out. If you are, again, 50 and above, make sure you have that PSA value and know what it is. And I stress that quite a bit. Know your results. You can ask your physician for your test results. You can ask them for your labs. If you have a CT scan, a chest x-ray, anything, get your results, get your medical records. A lot of places, a lot of clinics, they'll give them to you. Not all. Some will charge you. So some will charge you a small fee for your medical records. But you got to know what your numbers are. If you're giving blood and you don't know what that blood is for, are they checking a PSA? Are they checking your cholesterol? Are they checking to make sure you're not anemic? What's this being done for? Ask questions. It's okay to ask. It's okay to say, hey, what are you checking on me right now? Does it include this? Does it include that? And then getting your results, because depending upon what happens, you may actually see another physician or get referred to somebody else, and they're going to ask you those questions. And if you don't have your records with you, then they have to rely on getting those records from that physician's office, which is not difficult. That's not difficult to do, but it's good to know your history. I've seen many people who have had organs removed and they don't remember. So it can be difficult to keep track of that, especially if it's been many years. I understand you had your appendix removed in, 1969. You may not, it's now 2022. So maybe you just don't remember, but that's okay. But I think that's really key. And knowing your numbers, especially when it comes to prostate cancer, because for instance, when you're sitting in front of me, if you get to me at that point, so you've been diagnosed with prostate cancer and you're seeing a radiation oncologist or a urologist, I'm going to ask that question. So what's your and I may have your lab value from 2 months ago. That's great, but I'm going to want to know what your PSA was prior to that, because we pay attention to the trend. It's not just the actual number right then and there. It's the trend. What's that number been doing? Has it been going up slowly? Has it been going up rapidly? And that can tell us a lot about what is going on with the cancer. So when it comes to prostate cancer, I do talk about that quite a bit. It's not the actual number. It's not, it's 6.5, or maybe it's 3.5. Maybe it is still within the normal range. It can still be within the normal range, but yet it has jumped significantly. So that's the important as well. So I know I sound like a broken record, but I can't help it. But you got to know your numbers, and don't be afraid to get your medical records and have them in a safe place. There's a lot of things that you can do. You can have paper copies. You can digitize things. There's apps available for, keeping track of these things. But that's really important. So making sure that your doctor's checking a PSA and doing a digital rectal exam too. I haven't talked about that. I mentioned that a little bit earlier, but that's also part of prostate cancer screening that most physicians are doing as well. So actually being able to feel the prostate. You can feel an abnormality in the prostate. You can feel the cancer if there's one there. You can feel certain changes within the prostate that may lead the physician to think that there's a possibility that something's going on. And to also remember that if your PSA is up or it's going up, it doesn't always mean it's cancer. So that's another thing to stress. There are many factors that will cause your PSA to go up. So it can be an infection like prostatitis. It can be where you've maybe potentially one of the things that we tell individuals is not to have sexual relations right before they go in for their blood work, because that can raise your PSA. So there's a number of things that can cause your PSA to be elevated. If your prostate's growing in size, that can make your PSA go up. So it's not always cancer, but it may be something that it needs to be looked at, investigated, and can be easily treated. So I want to make sure that I say that as well.
So how can people learn more about your practice and get in touch with you?
Well, you can check out my website, which is centerpointoncology.com. My practice is located in Beverly Hills, California, Centerpoint Radiation Oncology. And my podcast website is cancerfromatoz.com. And the podcast is on all of the podcast players, Apple, Stitcher, all of that. And you can also reach out to me in terms of calling my office. So
thank you so much. We talked a lot about preventing cancer and treating of cancer, the screening of cancer, and you've really contributed so much to me, because I really didn't know, my dad had, he's in hospice right now, and he had an enlarged prostate, and he had, issues with that as well too. And I also thought that if he was diagnosed early, he would not be suffering as much as he is right now. So thank you so much for everything that you do for the patient community and for the world, with your podcast.
Thank you, Kalika. Thank you so much for those kind words. And thank you for having me on your show. You're such an inspiration to me. You're so successful as a serial entrepreneur, and hopefully I'll get to be that way too one day. But thank you so much.
You're already successful now, Dr. Morell. All right. Talk to you soon.
All right. Thanks.